And we're back on Second Street talking about medical tourism. Before the break, Dom, we were chatting about this whole notion of the cross-border directive that they have in the European Union. For those who aren't familiar with the policy, could you just give us the quick explanation as to how it works?
Yeah, for sure. So, how it works is that if you live in the European Union, you are allowed to travel to another country within the European Union, pay for surgery, and then be reimbursed for it by your home government up to the amount it would have cost to get the surgery done locally. So, for people in Europe, this opens up lots of options. Let's say that in Spain, there's a really long wait list to get your knee replacement done. And in France, there isn't. You can travel across to France, pay for it, and then be reimbursed for up to what it would have cost to get it done at home. Now, that last detail is really important because that means that it's basically cost neutral for countries in the long run. Because again, they're if the surgery is more expensive in the other country, then the patient is paying the difference.
And so, how did this you covered in a video for us a rather interesting, innovative kind of approach to this that some politicians in Ireland have come up with. Could you tell us a little bit about how that works and what they were doing?
Yeah, absolutely. So it was an idea that I think it's one of those things where it's just like it's so simple that you think, how could it possibly just be that easy? They basically just pile a bunch of people who need to get their cataract replacements done on a bus in the Republic of Ireland, and they drive them up to Northern Ireland, which is another country. It's
Mhm.
part of the United Kingdom. This program started while the United Kingdom was in the European Union, so it was underneath the
Mhm.
cross-border directive. Basically, those patients had the right to do this. And yeah, so I actually I got to go to Ireland and I got to go on this bus along with the at the time I think it was 40 or 50 patients who were going up to this private hospital in Northern Ireland in
Mhm.
Derry to get
Mhm.
their cataract surgery done, and they got it all of these patients done in a day and a half. And it
Mhm.
was just this really, really cool, really efficient thing, and it really it helped these people get their sight back. If you have cataracts for too long, you can go blind, and so this is like a very, very serious healthcare issue. And if you have a long wait list for it, it's not fun. And again, it's the same kind of thing where these Irish people have been paying into a government funded healthcare system for their entire life, and it was failing them. But the difference is that in Europe,
Mhm.
they're more willing to try out of the box solutions like this, like piling a bunch of people on a bus and driving them to another country.
Mhm. So, correct me if I'm wrong, but these were two politicians in Ireland that had this idea of chartering the bus. The policy was there for anyone so that they could, if they didn't want to get on the bus and do it that way, they would still have that right to, as you mentioned earlier, fly to Spain and get something done, or France or somewhere else in the EU. But these guys just thought they'd make it easy because there was a problem with long wait times for cataracts in Ireland. Is that how this all came about?
Yeah, yeah, that's right. Yeah, they have their own set of problems. By no means is their public or private system perfect in Ireland. And yeah, there was a
Hmm.
particularly long backlog for cataract surgery. And so yeah, yeah, these two politicians came up with the idea, and they went and did it. It's kind of
Hmm.
refreshing.
Hmm.
I would love to see it if in Canada we were more open to that. Just people having interesting ideas and then giving it a try.
Hmm.
And I think the reason we highlighted this thing in Ireland is because Canada is really well suited to do something similar. The bus ride that I took
Hmm.
from the Republic to Northern Ireland was about a 6 hour trip, which it was hefty. But if someone were to live in, say, Windsor, why couldn't they have a bus full of patients who need cataract surgery in Windsor and drive them down to Detroit? That's a 5-10 minute drive if you live downtown. And also
Yeah.
think about in my home province in southern Saskatchewan. There are areas where you're maybe an hour or two from Minot, North Dakota, and all along the Canadian-U.S. border, there are places where you're close to American cities that have healthcare facilities. So I think it's a really
Hmm.
neat, interesting idea that if some politicians in Canada did the same thing as those fellows from Ireland, we could really help people get care.
Yeah, well, I think you're right. Obviously, I'm a big fan of this idea. We've talked about it before, but listen, thank you for a quick update on your travels and appreciate your time today.
Thanks so much, Colin.